Hi, my name is Dr. Michael Kwame Obeng. Kwame, Kwame. That means I was born on Saturday. I'm a board certified plastic surgeon in Beverly Hills, and I love to do surgery. I love it so much I do it for free. Thank you. So the question is, what are the complications or possible risk associated with eyelid surgery? Okay? And I'm not trying to scare anybody. With every surgery, there are risks involved. Basic risk: pain, bleeding, infection, scarring, especially people of color, okay? And damage to surrounding structures. When it comes to eyelid surgery, okay, more specifically, there are certain things that can happen. You can have dry eyes, not ice, dry eyes as a result of the surgery not being done properly, okay? Or the surgeon failed to do a proper assessment, and as a result, dry eyes, okay? There is the lacrimal glands, okay? That's the glands that make lubrication to lubricate the eyeballs, okay? And sometimes some people who are not properly trained or don't know what they are doing can get into the lacrimal glands, and that can damage the retina, that can result in dry eyes. Or they might take it out so much that at night their eyes will dry out, okay? So that's one thing. Risk of blindness, okay? There's something called retrobulbar hematoma, and that's one of the most, deadly complications that can arise after eyelid surgery, where you will have a collection of blood behind the globe, okay, the eyeball, okay, in the socket. It's called retrobulbar hematoma. What that does is it compresses on the optic nerve. The optic nerve is what connects the eyeball to the brain. It sends signals, and you can go blind. Okay. What else? So those are the most, and of course, scars. Okay, and then lower eyelids. You have something what's called ectropion, where the eyelid is pulled down because of excessive resection of the skin. So these are some of the complications that can arise following eyelid surgery. We talk about dry eyes, okay? Cornea abrasion, that can happen. When the cornea is not protected, you can have scratches on the cornea, and it's very painful and very irritating. So these are some of the things that can arise. So pain, bleeding, infection, scarring, blindness, okay? Ectropion, which is a Sally's scar that pulls down on the lower eyelid, so they have this, and then of course it causes dry eyes of itself, damage to lacrimal glands, and then over resection. Okay, if you take too much fat out, sometimes they look gaunt, they look like ghosts, and you don't want that. Okay, so choose your surgeons wisely. Thank you. So, what are the risks and possible complications of eyelid surgery? Okay, with every surgery, there are risks involved. So the question is, what is the recovery like following eyelid surgery? Okay? And what can I do to have a faster recovery? Just like with any surgery, you have to be at your optimal self. Okay? Good diet, exercise, good eating habits, good sleeping habits. All these things will get you good results. Okay? Not being a smoker. Okay, we all know this is the $2 billion question. Smoking always impedes healing. So smokers, stop smoking. Okay, but a lot of times, bad habits are very difficult to kill. And somebody who smokes all the time, they're not going to stop smoking just because they're having surgery. So sometimes I would tailor the surgery to the patient because of the history of smoking. Okay, so stop smoking if you want the best results. Hydration, high protein diet. Okay, and of course, a lot of people come out of surgery, other modalities to limit or minimize bruising. So we talk about having arnica. Arnica helps. Okay, arnica helps with the bruising. Bromelain helps, and the swelling. Okay, so people talk about pineapple juice, papaya, all those things help. Okay, but eyelid surgery is so innocuous, meaning it's not it's not a big deal. It's not a big deal. So, just be healthy, eat, exercise, and of course, the first few nights, keep your head elevated for the swelling to go down. If you're one of those people who retain a lot of fluid and also very slow to have the swelling go down, I will give a low dose steroid. A low dose steroid that you take over a 5-day course, and that helps with the swelling. And of course, this is Hollywood. People like to wear big, thick sunglasses to cover the eyes. I hope that helps. Thank you. How do I handle complications of eyelid surgery? I don't get complications. I'm just joking. I pray to God, okay? My old boss once said that if you do enough surgery, you're going to have a complication, which is true. I've had complications of eyelid surgery, yes. Okay? Some of it is something called milia, okay, which is these little dots underneath the incisions, or you can scrape it with an 18-gauge needle. Some of the other complications I have seen personally, I've had ectropion, okay, this is my early days, over resection, but thank God I know how to fix it, okay. If you over resect, you have to go and release the scar tissue, okay, take a piece of the palate, graft, put it in the skin graft, that covers it. So these are some of the things, but it depends on the complication. Knock on wood, glass. Okay, I've never had one of the most dreadful complications of eyelid surgery. It's called retrobulbar hematoma, which is an emergent thing that needs to be solved right away. If a patient, when I do eyelid surgery that evening, I check on the patient before I go to bed, make sure everything is fine. As soon as they complain of eye pain, wherever I'm at, I will meet that patient to make sure that they don't have retrobulbar hematoma. Okay, but that's one of the things for the young surgeons out there. Make sure that you check on your patients, let your office staff do it if you don't do it yourself, and make sure that nobody is having pain in the eye. That's a bad sign. But these are some of the little complicated, these are some of the myriad of complications that can happen. And personally, infection is very rare for eyelid surgery because of the vascularity of the area. One of the things that I have personally have to address is the milia I described, and also the ectropion for lower eyelid surgery or the rejuvenation. Okay, I hope that helps. Thank you. When can I wear contact lenses after my eyelid surgery? Never. No, you can wear it. I always tell patients that whenever you don't have any discomfort, okay, when all the swelling goes down, so I would tell my patient for the first 2 weeks not to wear contact lenses. Okay, just let everything heal. Don't mess with your eye. Most people are healed within a week. I tell my patient, don't schedule any social events, within the first week. Okay, you can cover your eyes with the bruising with mineral makeup after the first week. Okay, if you have to go out. Most of the stitches that I use, or most surgeons use, are dissolvable. Some surgeons will use a monofilament that can be pulled out to also limit scarring. But all in all, most people are ready to rock and roll after 2 weeks.